And first tonight, it is a service that shapes our lives. And today, patients and experts across the North East are responding to a long-awaited plan to breathe new life into the NHS.
The government has published a vision to bring health services closer to home to try to improve care and reduce waiting lists.
So what could it all mean here in a region where so many people rely on the NHS? Our health correspondent Helen Ford reports.
Forces veteran Paul Stanley is a daily visitor to this support organisation near Seaham in County Durham. He also has long experience of using the NHS. On the day that reforms to the health service were announced, Paul told me where he found the pinch points lie.
It was mainly the waiting, because I knew exactly what was wrong and I knew exactly what was needing to be done. I just didn't know when it was going to be done.
What impact did that have?
Well, it didn't do much for my anxiety and my mental health, plus I had to travel because I had to go all the way to Newcastle to have it done.
The Prime Minister and Health Secretary say those issues, among many, are addressed within the government's 10-year plan, a prescription aimed at making the health service fit for the future. The plan has three key aims: taking more treatment and care from hospitals and into communities, shifting the emphasis from treating sickness to preventing it in the first place, and what's termed a move from analogue to digital, in other words, ensuring greater use of technology.
To succeed, we need to defeat the cynicism that says that nothing ever changes, they're all the same, and the NHS can't be reformed. We know that the change in our plan is possible because we see it already happening.
This centre in Newton Aycliffe is run by the charity PCP, which delivers a range of health projects, some in partnership with the NHS. There's also a GP practice and a pharmacy here, so the unit offers a flavour of the kind of neighbourhood centre we could be seeing more of.
It suddenly lands on your shoulders.
Sue Turner told me she's seen the benefits of community care using a cancer support service based here.
Someone like myself who's been a cancer sufferer, survivor, and has other ongoing health problems, mobility problems, getting to places is always an issue. And then just simply not having to sit in a waiting room where I don't need to be. And then thirdly, the huge benefit to me in terms of my well-being, my health, my recovery, my support.
Another example of taking care into communities here at the Metro Centre in Gateshead, a facility where patients come for diagnosis. At the same time, they can do their shopping.
I think there's a definite need for a restructure of the NHS services, and hopefully by doing some of the changes that will actually bring the money into the right places, into the heart of the community, and allow the hospitals to actually do what the hospitals are good at, which is the acute care.
For a health service under huge pressure, this has been described as a make or break moment to give it a new lease of life.
And Helen joins us in the studio now. Helen, we've talked there about a shift from hospital to more community-based care. How else is the plan designed to help regions like ours here in the North East?
Well, as you saw, I was filming earlier today in County Durham, and that is the part of the North East with the lowest life expectancy where women are concerned. And that makes another part of this plan really significant, because the government wants the NHS to help us all to, yes, live longer, but also to live better quality lives, and that means tackling the causes of ill health. We asked one expert how realistic that is.
It's a very laudable goal, and it should be realistic if taken over time. So a 10-year plan is a good start, but this was something that will need to be introduced over 20 years, for example, before we start seeing differences on every level. But we can see some immediate differences.
Now, another factor here is money. Some experts have questioned whether it's possible to implement this ambitious plan, even with extra spending in the NHS. Finally, it is worth reminding everybody that the NHS is only one part of good health. Many other factors come into play as well. Poverty is one, housing just another.
Okay.